After 60, one supplement millions of seniors trust to protect their heart may quietly increase risk when it's taken the wrong way, without obvious warning signs. I'm talking about fish oil, also known as omega-3, a supplement many older adults take every single day with good intentions. Most seniors start fish oil hoping to protect their heart, sharpen their mind, ease joint pain, and stay independent longer as they age. Yet many still experience stiff joints, brain fog, dizziness, or a growing sense of unsteadiness when walking, especially first thing in the morning. Some even notice bruises appearing more easily, minor cuts bleeding longer, or feeling slightly lightheaded without understanding why. That creates confusion because fish oil has been promoted for decades as one of the healthiest supplements you can take. And to be clear, fish oil itself is not dangerous or useless when used correctly. The real problem is that most people take fish oil the wrong way after 60, and their aging bodies respond very differently than expected. After years of working with older adults, I've seen fish oil mistakes quietly undermine balance, safety, and confidence more often than people realize. Fish oil is one of the most misunderstood supplements in senior health, especially when combined with medications and age-related biological changes. There are 7 common mistakes seniors make with omega-3 supplements, and almost everyone makes at least one of them unknowingly. The number 1 mistake is the most dangerous because it can affect bleeding risk, blood pressure, balance, and fall safety. The good news is these problems are not permanent, and they are often completely preventable with better understanding. When fish oil is used correctly, it can truly support heart health, brain function, joint comfort, and long-term independence. But when it's taken out of habit instead of intention, it can quietly work against the very goals seniors care about most. Today, I'm going to explain why standard fish oil advice often fails after 60, even when people believe they're doing everything right. More importantly, I'll show you how to use omega-3 in a way that actually fits an aging body and changing physiology. Before we go any further, let me ask you something important so we can learn from each other. Where are you watching from today, and how old are you this year? And just for fun, are you taking fish oil mainly for your heart, your brain, your joints, or because someone simply told you to? Now that you understand why fish oil advice often fails after 60, let's walk through the most common mistakes step by step, starting with one many seniors make without realizing it. Mistake 7. Assuming all fish oil supplements are the same. Many seniors believe all fish oil supplements are essentially identical, differing only in brand name or price, but this assumption causes serious problems after 60. In reality, fish oil quality varies dramatically, especially in purity, freshness, and how the oil is processed and stored. Lower quality fish oils often become oxidized long before they reach your body, even if the expiration date looks acceptable. Oxidized fish oil does not reduce inflammation properly and can actually increase oxidative stress inside aging cells. This is especially risky after 60, when the body's ability to neutralize oxidative damage is already reduced. Many seniors unknowingly take fish oil that smells strongly fishy, assuming that odor is normal. In fact, a strong fishy smell is often a sign the oil has already degraded. When oxidized oils enter the bloodstream, they may irritate blood vessels instead of protecting them. This helps explain why some people feel worse, not better, after starting fish oil supplements. Joint stiffness, stomach discomfort, and subtle inflammation can actually increase with poor quality products. Older adults are more sensitive to these effects because digestion and liver detoxification slow with age. Cheap fish oils are often made from lower-grade fish or exposed to heat during processing. Heat accelerates oxidation and reduces the beneficial omega-3 fatty acids your body actually needs. Labels rarely explain oxidation levels clearly, making it difficult for seniors to judge quality. As a result, many people believe fish oil does nothing for them. The problem is not omega-3 itself, but damaged oil that no longer functions as intended. High-quality fish oil should have little to no fishy aftertaste when swallowed. Proper storage and antioxidant protection inside the capsule also matter significantly. Choosing poor quality fish oil turns a potentially helpful supplement into a biological stressor. The mistake is assuming all fish oil is the same, when quality determines whether omega-3 heals or harms an aging body. Mistake 6. Taking fish oil without considering its blood-thinning effects. Many seniors take fish oil believing it is always gentle and protective, without realizing omega-3 fatty acids directly influence how blood clots. After 60, the body's clotting balance becomes more fragile, especially for those already managing cardiovascular conditions or taking daily medications. Fish oil reduces platelet aggregation, which can be helpful in moderation but risky when combined with other blood-thinning influences. Many older adults already take aspirin, anticoagulants, or heart medications that affect bleeding risk. Adding fish oil on top of these without guidance can quietly push the body too far in one direction. This often shows up as easy bruising, nosebleeds, bleeding gums, or cuts that take much longer to stop. Some seniors notice dark bruises appearing without remembering any injury at all. Others feel lightheaded or slightly weak, especially when standing up or walking quickly. These signs are often dismissed as aging or circulation problems rather than supplement interactions. The danger is subtle because fish oil does not cause immediate pain or dramatic symptoms. Instead, it slowly increases vulnerability to falls and injuries that bleed more than expected. After 60, even minor falls can become serious events when bleeding risk is elevated. High doses of fish oil amplify this effect, especially when taken daily without reassessment. Many people assume natural supplements cannot interfere with medications, which is not biologically accurate. Omega-3s are powerful compounds, not neutral nutrients, and they actively change blood chemistry. This is why dosage and medical context matter far more after 60 than earlier in life. Ignoring these interactions can turn a heart-supporting habit into a safety concern. Used thoughtfully, fish oil can still be beneficial without increasing bleeding risk. That requires awareness, appropriate dosing, and coordination with existing treatments. The mistake is taking fish oil blindly, without considering how it alters blood behavior in an aging body already managing multiple risks. Mistake 5. Using the wrong EPA to DHA balance for your needs. Many seniors assume any omega-3 ratio works the same, but EPA and DHA serve different biological roles, especially after 60. EPA primarily supports inflammation control, circulation, and heart rhythm stability. DHA plays a larger role in brain structure, memory, vision, and nervous system signaling. Using the wrong balance means you may support one system while neglecting another that needs more help. For example, joint pain and vascular inflammation respond better to higher EPA support. Memory concerns, mood changes, and balance issues often require adequate DHA availability. Many off-the-shelf fish oils provide generic ratios designed for younger adults, not aging brains and hearts. After 60, the brain becomes more sensitive to DHA shortages due to slower fatty acid transport. At the same time, chronic low-grade inflammation increases the need for EPA. Taking a one-size-fits-all formula ignores these age-related shifts. This is why some seniors notice heart benefits but no cognitive improvement, or vice versa. Others feel no change at all and assume omega-3 doesn't work for them. The issue is not omega-3 effectiveness, but mismatched targeting. Medication use, diet, and health goals all influence which ratio makes sense. For example, statins, diabetes, or vascular disease may change EPA requirements. Meanwhile, memory decline or balance concerns may increase DHA demand. Ignoring these differences leads to wasted supplementation and lingering symptoms. Correcting the EPA to DHA balance often produces clearer, more noticeable benefits. This adjustment does not require higher doses, just smarter formulation choices. The mistake is assuming all omega-3s act the same, when precision matters far more in the aging body. Mistake 4. Taking fish oil at the wrong time or without food. Many seniors take fish oil first thing in the morning on an empty stomach, assuming consistency matters more than timing or context. Omega-3 fatty acids are fat-soluble, meaning they require dietary fat to be absorbed effectively by the digestive system. When fish oil is taken without food, absorption can drop significantly, even when the dose appears adequate on the label. This leads many seniors to believe fish oil doesn't work, despite taking it every day. Poor absorption also increases the likelihood of stomach discomfort, nausea, or fishy burps. These side effects often cause people to skip doses or stop supplementation altogether. After 60, digestion slows and bile production changes, making proper timing even more important. Taking fish oil with a low-fat meal further reduces how much omega-3 actually enters the bloodstream. This is especially common among seniors following outdated low-fat dietary advice. Without enough fat present, omega-3s simply pass through the body unused. Timing also matters because some people feel lightheaded or uncomfortable when fish oil is taken too early in the day. Taking it later with the largest meal often improves tolerance and absorption. For many seniors, dinner is the most consistent and balanced meal of the day. This makes it an ideal time for fish oil intake. Better absorption means more omega-3 reaches the heart, brain, and joints where it is needed. It also reduces digestive side effects that discourage long-term use. Small changes in timing can make a noticeable difference within weeks. This does not require a higher dose or a different brand. It simply requires respecting how the aging digestive system works. The mistake is focusing on the pill itself while ignoring the conditions required for fish oil to actually do its job. Mistake 3. Assuming more fish oil automatically means more protection. Many seniors believe that increasing fish oil doses will automatically provide stronger protection for the heart, brain, and joints after 60. In reality, omega-3 fatty acids follow a dose-response curve, where benefits level off and risks begin to rise beyond certain amounts. After 60, the body becomes more sensitive to changes in blood pressure, balance, and circulation caused by high omega-3 intake. Excessive fish oil can lower blood pressure too much, leading to dizziness or lightheadedness when standing or walking. This effect may feel subtle at first, but it increases fall risk over time, especially in seniors with already reduced balance. High doses can also exaggerate blood thinning effects, even in people not taking anticoagulant medications. This makes bruising more common and slows healing from minor injuries. Some seniors notice weakness or fatigue and assume it is aging rather than an excessive supplement dose. More is not better when the body's regulatory systems are already under strain. Omega-3s are biologically active compounds, not neutral nutrients that can be taken without limits. Clinical benefits plateau at moderate doses for most older adults. Beyond that point, additional capsules offer little added protection and more potential side effects. Many people increase doses because they feel no immediate benefit, assuming patience requires more intake. In truth, fish oil works gradually and systemically, not as a fast-acting pain reliever. Taking large amounts does not speed results, but it can disturb internal balance. Individual needs vary based on diet, medications, body weight, and existing health conditions. Ignoring these factors leads to unnecessary overuse. A lower, consistent dose often produces better long-term outcomes than aggressive supplementation. Effectiveness comes from appropriateness, not intensity. The mistake is believing that more fish oil equals more protection, when the aging body responds best to precision rather than excess. Mistake 2. Ignoring interactions with medications and medical conditions. Many seniors take fish oil without realizing it can interact with common medications used after 60. Omega-3 fatty acids influence blood pressure, blood sugar regulation, and clotting pathways, which are often already affected by prescribed treatments. When combined without coordination, these effects can quietly amplify or counteract medications in unpredictable ways. Blood pressure medications may work too strongly when paired with fish oil, leading to dizziness or weakness. Diabetes medications can also interact, as omega-3s may influence insulin sensitivity and glucose handling. Seniors managing heart rhythm issues are especially sensitive to changes in electrolyte and circulation balance. Fish oil can subtly alter heart rate variability, which matters more in aging cardiovascular systems. Certain medical conditions, such as liver or kidney disease, also affect how omega-3s are processed and cleared. When clearance slows, even moderate doses can accumulate more than expected. Many older adults take multiple prescriptions daily, increasing the likelihood of overlapping effects. Yet supplements are rarely reviewed with the same care as medications. This creates a blind spot where side effects are attributed to age or illness rather than interactions. Symptoms like fatigue, lightheadedness, or easy bruising may be early warning signs. Ignoring these signs delays proper adjustment and increases safety risks. Doctors may not ask about supplements unless patients volunteer the information. As a result, fish oil use often goes unmonitored for years. This does not mean fish oil must be avoided, but it must be contextualized. Individualized dosing and timing can reduce interaction risks significantly. Open communication with healthcare providers allows omega-3 benefits without unnecessary complications. The mistake is treating fish oil as separate from medical care, when after 60 it must be considered part of the whole health picture. Mistake 1. Treating fish oil as a daily habit instead of a targeted therapy. This is the most dangerous mistake because omega-3 is not a harmless routine pill. It is a powerful biological tool that actively changes inflammation, blood flow, and cell signaling. After 60, the body responds very differently to omega-3 than it did at 40, especially in the heart, brain, and vascular system. Fish oil is designed to correct specific imbalances, not to be taken indefinitely without a clear goal. Many seniors continue taking the same dose for years simply because they started once and never reconsidered the reason. Over time, the original need may change, disappear, or require adjustment. Inflammation levels fluctuate with age, diet, medications, and activity, yet supplementation often remains frozen in place. Using omega-3 without reassessment can quietly shift blood behavior, balance, and bleeding risk. This is especially concerning for seniors whose stability and fall risk already demand precision. Targeted therapy means knowing why you are taking fish oil and what outcome you expect. Is it for triglycerides, joint inflammation, mood stability, or cognitive support? Each goal requires a different dose, ratio, and duration. When fish oil is taken mindlessly, benefits blur while risks accumulate silently. Seniors may attribute new symptoms to aging rather than a supplement that no longer fits their physiology. This creates a false sense of safety that delays necessary changes. Omega-3 works best when used deliberately, reviewed periodically, and adjusted as health status evolves. Short-term use for a defined purpose often outperforms endless daily intake. Precision protects independence by minimizing side effects that increase dizziness, weakness, or bleeding risk. The aging body rewards intention, not routine. Fish oil should serve your health goals, not become an unquestioned habit. The mistake is treating omega-3 like a daily ritual, when after 60 it must be used as a targeted, carefully managed therapy. Conclusion. Fish oil was never the problem. Misunderstanding how an aging body responds to omega-3 has always been the real issue. After 60, supplements no longer behave the way they did earlier in life, especially those that affect blood flow, inflammation, and balance. Taking fish oil correctly is not about taking it forever or taking as much as possible. It is about purpose, quality, timing, dosage, and awareness of your overall health picture. When omega-3 is used intentionally, it can support heart rhythm, brain clarity, and joint comfort. When it is used carelessly, it can quietly increase risks seniors cannot afford to ignore. The encouraging news is that most fish oil mistakes are common and fixable. You do not need to abandon fish oil. You need to use it wisely. Small adjustments can dramatically improve benefits while reducing unnecessary side effects. After 60, precision matters more than habit. Your body deserves support that adapts as you change. Heart health, brain health, and mobility are deeply connected at this stage of life. Protecting one without harming another requires understanding, not fear. Knowledge gives you back control over choices that affect your independence. If this video helped clarify something you've been unsure about, it can help someone you love as well. Please consider sharing it with a friend or family member over 60. I'd love to hear from you in the comments below. Where are you watching from, and how old are you this year? If you want more clear, practical guidance for senior health, be sure to subscribe to this channel. Together, we can make smarter choices that protect safety, confidence, and independence for years to come.